Hey there, we're going to talk a little bit today about tennis elbow. Tennis elbow can be very, very debilitating. It's also called lateral epicondylitis. It comes from the radius, which is the bone on the outside of your forearm, where it attaches at your elbow. That joint just kind of gets locked up where it's not functioning like it's supposed to. Gets some scar tissue in there, and now those muscles that come across it, the tendons, become inflamed, causing tendonitis, which again, we talk about itis terms, that means inflammation. So those tendons become inflamed right where it attaches at the elbow. Tennis elbow is very, very painful, and it can make your arm almost unusable at times because it's so painful. The first thing we need to do, number one, because it's itis, it's inflammation, we need to use ice on it. 20 minutes at a time, put an ice pack on there. I can't stress enough how much ice helps that area. Number two, they make little bands that come across the elbow called a tennis elbow support that you can wear that holds that bone down where it's supposed to be and doesn't let you irritate it. Number three, we've got to get that joint functioning correctly, break up that scar tissue, get the joints moving like they're supposed to. If we can do that, the problem goes away, the inflammation goes away, and the pain goes away. Number four, we can work those muscles, really strip those muscles, get in there and dig deep and get the spasms out of there. So if we can get the spasms out of there, get the inflammation out of there, get the joint functioning like it's supposed to, tennis elbow can be very fixable and manageable. So it's one of those things that can be very painful if you don't treat it. But if you come in, we can get that thing moving, get it treated, and we treat them all the time in our office. And it's something that's very fixable and manageable, like I said. If you don't treat it, it becomes a chronic problem that can cause you months and months of pain, which you really don't want. Anyways, if you have tennis elbow or you know somebody that has tennis elbow, get them into our office so we can get on that thing and start moving it like it needs to be moved and get that ice on there like you need to. Thanks again, guys. I hope this helps.